Hello everyone. Today this video is about what you can do in your clinical postings given in that 3 hours period. We go for 2 hours to 3 hours. Sometimes it may extend beyond 12 p.m. because we need to correlate with the cases in the morning and then in the classes afternoon. Sometimes if your case discussion is not complete, they might ask you to come in the evening or so. But please do go and listen to the classes and try to complete the case by then. And what can you do in your clinical postings beforehand? See, suppose if you wanted to take a case in a particular subject, make sure or at least try to make a case written beforehand on the previous day itself, so that it'll be much more easier when you go on the next day and you can directly go find a case for yourself and directly take down the notes from that. And you might have some time for case discussion by your professor or your postgraduate, and by that it'll be helpful, and you can complete your case really quick. And suppose if you are in a unit where they will not teach you, which happens most of the time, and it happened to me too, and I was in units in various subjects where they used to not teach me anything, and I was at a great loss because of that. So what can you do in order to help that damage, in order to prevent that? Firstly, you can take notes from your senior who have been in a better unit, and note down the important points that you might have missed. And the second thing is that from your friends who are in other units where they teach those important clinical points, you can just get them teach you. Sometimes we might think that it's okay, we'll get it done, we'll get it explained towards the end posting or just before the practicals. It doesn't happen that way. Many a times even I thought that I'll get it explained, but you'll not find time. So whenever possible, even after having your dinner or somewhere during your chit chat talks with your friends, make sure that you at least have a small discussion on topics which were taught to them, and try to take a notes from them and read that. By that way it will be helpful. And after that, do not take it for granted that girls will usually get breast as their clinical examination clinical examination topic in their finals, and boys will only get hernia. That is not the case, and I personally have taken hernia in my final examination. So you need to be prepared with both hernia as well as breast examination. And then we have another issue here where the first and last batches, mind you, the first and the last batches, we have you people have to go for pediatrics and your gynecology during the last part. That is mostly during the end of for 8th semester. That is when you have your first intervals. During that part, you need to keep going here and there from the old hospital to new hospital, both for your gynec as well as pediatrics, especially for the first and the last batches. It is mandatory that you people are at least in hand learn those subjects which you might be at loss. And even just before the final examinations, which will be starting from January second week or so, you have to go to pediatrics postings even till the end of December. So it will be a really great problem, because you'll be losing about 1.5 to 2 hours on your journey time, and you'll be tired after getting home, and you cannot get time to prepare for your finals. So what I tell you is, where you will be having orthopedics or medicine or surgery, that time is a little chill time, and make sure that you cover these topics or at least some part of it beforehand, so that it might be useful and you might not be at stress or trouble during the later part. And then we have first, at least see that during the last 1 month, that is the December, try to complete your portion as much as possible by November end. And at least with clinicals, try to be thorough, at least with each and every semester. Try to be thorough and read whatever topics or whatever cases you have taken. Immediately the same day, go home and then try to revise those topics alongside your theory. We usually do not have time to read both theory and practical on a single day, but you have to make time that you complete each and every topic by the end of the day, or at least the end of the week. You need to go through every systems, and mind you, CVS is a compulsory case in your final examination. So try to get a few more CVS discussions during your curriculum. And you shouldn't always expect that the professors will come and teach you. So when they're not coming and teaching, it is better that you try to go and join in other units, which is not possible. They will not allow. Apart from that, you can just go watch online videos. I'll just send you a few links of good online videos that I have watched, which might be helpful for practical. It is very much useful, and it has helped me a lot during my end exams. That is audio clinical cases by Dr. Ghanshyam Vaidya, where you find cases for all the subjects. subjects, and I personally found medicine and pediatrics quite useful. I haven't gone through much of surgery and obs and gynae. Obs and gynae, we have amazing teachers there, and they'll explain you everything. For surgery, I followed Ankit Suneyal videos. They are just amazing. I just followed them blindly and watched for like 2 to 3 times, and that is sufficient to cover everything. Thank you. I'll just send the links. The links, I'll be mentioning them in the description box below. Just check them and try to complete your syllabus according to those links. They are just quite small videos, and try to make notes out of it. It will be highly helpful towards your end. Thank you.